Good afternoon, everyone. Welcome, welcome. It is August. It is our August Flint Community Webinar, and I am so glad that you all have joined us. My name is Dr. Janae McCoy White. I am an academic specialist research for Charles Stewart Mott Department of Public Health for Michigan State University. And today we have a great group of individuals who will be talking about maternal health. Maternal health is my bag, my passion. So I am glad to be on this with all of these wonderful individuals that's talking about different aspects of their work with maternal health. And so today, just to give you a glimpse of who we have today, we have Dr. G, who's been on the webinar, who will be able to answer some of your questions. We have Nurse T, who will also be answering some of your questions. And then we have Dr. Gail Ship, who is an assistant professor at Michigan State University, and she will be talking about breastfeeding and nutrition. We have Christine Huff, who is a project coordinator for Roses and a research assistant for HEAL program. And we also have Susan Lampier, who is the project coordinator for the HEAL program at Michigan State University. And this is a great thing. Number one, thinking about maternal health. What is maternal health? And maternal health really refers to birthing people during pregnancy, childbirth, and postpartum period, which most people think, okay, after you have the baby, that's it. But postpartum period is really up to 12 months after having the baby. So that's another thing. And for me, I am I work on the implementation specialist for our Miracle Project and Miracle Center. Our Miracle Project is a multi-level intervention for racial equity for maternal health. Our Miracle Center is a multi-level intervention to advance maternal health equity. And that one is where we're going to expand our Miracle Project to 12 communities here in Michigan. But more importantly, this is August, and August is Breastfeeding Awareness Month and Breastfeeding Month. And so we are going to jump this off with Dr. Gail Ship, who is I say a guru with breastfeeding and nutrition. And I am elated to be sitting here with her to hear her good work. Dr. Ship.
Hi.
Hello. Thank you for coming.
So, did you want to ask me questions, or how should I just jump right on in and start talking about breastfeeding?
So first, just talk about breastfeeding and why it's so important to think about breastfeeding when you are about to be a mom or thinking about being a mom. So what is the importance of breastfeeding?
Sure. So there are many benefits when it comes to breastfeeding. One of the most obvious ones is that it's the baby's first nutrition, right? And it meets all of the baby's nutritional needs. And so that's one of the most important. It can sustain the baby's life. In addition, it protects your baby from many different infections as well as diseases, particularly when you're thinking of sudden infant death syndrome. It has been shown within the literature to reduce hospital visits, atopic dermatitis, and then the benefits of breastfeeding extend further into the child's adult life. And so when you're thinking about obesity, even cardiovascular disease. And so there's a lot of benefits. In addition to benefits for baby, there's many benefits for mom as well, too. And so when you're thinking about mom and her having benefits, it reduces the risk of different cancers. So definitely breast and ovarian as well as uterine cancer. It also can reduce the risk of obesity as well as cardiovascular disease. And so oftentimes we just encourage mom to try to breastfeed. Any amount of breast milk can have a positive health effect, but the longer durations of breastfeeding have been shown to have longer protection and more greater benefits. And that's one of the studies that I recently published on within pediatrics, just showing how breastfeeding for longer durations reduces the risk of child obesity. Also, it increases the emotional bond as well as attachment with mom and baby. And that's always nice as well, too. And again, you don't see these benefits from formula. It's obviously cheaper, because you don't have to pay for it, things of that nature. So, yeah.
And so it's been a minute before I had my child, but my last one, but the first thing, they would say is, it helps with shrinking, the uterus afterwards. So those who are trying to, get your snap back afterwards, breastfeeding has that for you. But also, what about those who have issues with breastfeeding? So I have a couple of questions. That's the first question. It's like, what can they do to help increase their lactation so that they can lactate for their child? And the second one, can you explain what sudden infant death syndrome is?
Yeah. So, when you're thinking about, so when you talked about the increasing the lactation or the breast milk for child, so oftentimes, this is a challenge with breastfeeding, right? And it's a typical challenge that all moms may see. And really, when we think about that, it's a perceived notion that you have insufficient breast milk. So sometimes, so really when baby comes out the womb, their belly is about that big, right? And so, we think, and they're feeding often. And so one of the things that I would suggest is if you're unsure about your milk supply, and if you're thinking that you might have low milk supply and you want to increase the amount of breast milk that you're making, or if you're just unsure, talking to your doctor about that, and also trying to have some lactation support. So that's where we have different lactation specialists. So you have your certified lactation educators and your specialists, as well as your IBCLCs that can actually come out to your home and assist with any technical issues. And so a lot of times when we leave the hospital, we can, and this is what we see within the literature, right? Breastfeeding initiation rates are very high, so they can get you latched on and help with initiating breastfeeding. But when mom goes home, she's unsure and may experience some of these challenges, unsure of her milk supply, not sure if baby's getting enough. And so they tend to stop breastfeeding. And that's where the breastfeeding duration rates or exclusivity rates kind of trickle down. And so having that additional support, particularly if you're unsure, if you're having these technical challenges, having a lactation specialist coming out to your home to do some help is always necessary. And even a tagline for doulas, because doulas also assist with that. There are some doulas that can assist you not only during the pregnancy or prenatal phase, but also postpartum, and coming out to your home to help with that as well too. So those are things to kind of think about when you're unsure. Because on the opposite end, there's moms that can be engorged and really making too much breast milk. But so any challenges, if you're unsure, reaching out for that support.
Okay. Okay. So when we're looking at this, when we're looking at doulas and first off, thinking about, I had to go to the doctor to talk to them about my milk supply. What types of questions, besides saying, you know what, I don't think I'm making enough milk, what other questions should they be asking their physician or
Yeah.
healthcare provider?
Yeah. Well, I mean, if they're unsure if they're making enough milk, so usually they'll do an assessment, an infant feeding assessment. And so at that point, that's where if they have the individuals that are trained for this, then they'll weigh the infant. They'll actually watch you and assess how you're feeding the infant. How are you latching that infant on, things of that nature, to get a better understanding of how is the feeding going? How many, they'll also ask about wet diapers, poopy diapers. So you usually with a breastfed infant, you'll see more wet diapers, right? They digest the breast milk a little bit easier. So you'll oftentimes see a lot of more diapers that you're changing. So they'll ask you, how many diapers do you have? They'll also ask you about, or they might ask you, how many times do you put the infant to the breast, and for how long? So that's very important as well too. If you aren't feeding the infant often, oftentimes your breast milk supply may go down. And so, but essentially, there should be a formal assessment done, an infant feeding assessment, to kind of indicate how the breastfeeding is going. So asking your doctor about those things, and they'll ask those questions usually when you go in for visits as well too, but or just asking to speak to a lactation professional if they have someone on hand is always helpful. They can provide that technical assistance.
Okay. So when we're thinking about these things, and what about managing, breastfeeding? Because um, that the pain of it sometimes it's a little bit painful sometimes, but how to manage that pain and what do you see people should do, or your thoughts on it?
Well, so again, the pain, that's a misconception. We put that out there. It shouldn't necessarily be painful. So if it's painful, there could be some, you could be latching the infant on incorrectly, right?
Okay.
And once again, then maybe talking to a professional about that, because if you're finding that you're having soreness or there's some injury or you have mastitis, things of that nature, then you probably want to reach out to a professional to see what's going on, because essentially the infant could be latching on. There could be a latch issue there, right? Um, and so you want to be able to keep breastfeeding going. So these are some of the technical challenges that, again, a lot of women experience, and then they'll just stop breastfeeding. So reaching out to a professional to figure out how do we deal with that? So, but outside of pain, there's societal factors that impede mothers from continuing to breastfeeding, right? And so when we think about um, limited access to like paid maternity leave, or even barriers to breastfeeding in the workplace. And so thinking about those are bigger things that women oftentimes need to think about when they're pregnant and then going back to work, right? How are we going to conceptualizing how you're going to breastfeed? What are your breastfeeding goals? Who's a part of your support system, and how to help meet those goals? And thinking about your work. So when you go back to work, how are you going to still be able to breastfeed or pump and still feed your infant and continue on? And so, and making sure that you're at a place that's supportive of that, right? And so I think some of the times that's where you find additional barriers, So again, women going back to work with less than 6 weeks, so they barely healed, right? And or having inflexible work hours, definitely inadequate breaks, or lack of privacy when you think of having to pump. I remember times having to pump and not having a private space, or not having places to actually like store your breast milk. These are all issues that women oftentimes experience and will have them just kind of stop, and that's where the duration rates begin to plummet.
Okay. Okay. So, and thinking about that, what about nutrition? Is that something that could help with their lactation and to keep it going correctly and moving smoothly?
Yeah, absolutely. And so during pregnancy, these are things, so women need to consider their nutrition overall. Oftentimes, maternal nutrition becomes very important during pregnancy and lactation. And so definitely trying to consume the nutrient dense diet is very important. And so those foods, they not only impact mom, but they can also have an effect on the baby during utero, right? And so the recommendations that are out there is definitely important to follow those during nutrition, like nutritionally relative to the weight gain during pregnancy. And this really helps to assist with the optimal growth for the infant. And also it has long-term benefits as well too, again, for mom as well as for the baby, particularly around birth and health outcomes. And so diet is important. So I always tell moms like, and then I also indicate, the don't have this concept of eating for two. Just make sure you try to have a diet that's nutrient dense. And so some recommendations I also just kind of put out there and encourage mom, look at the nutrition label. Technically, during pregnancy, women should consume an additional 300 kilocalories per day. And most of their weight gain really should come on during the second to third trimester. And so when you're thinking about 300 calories, like what does that look like? That's not a whole meal. That's like an extra snack or two, right? And when you're lactating, you're actually burning more calories. So you should consume a nutrient dense diet during that time as well too. So if you're lactating and you're breastfeeding the way you should, you can burn anywhere between 500 to 700 calories per day. And so just making sure that you're eating a nutrient dense diet is really important, consisting of fruits, vegetables, your whole grains, things of that nature, fish. So your good fats, and so omega-3 and your omega-6 fatty acids as well too.
So we had one question,
Mhm.
and the individuals said this was very painful. Community resources and doctors were unable to assist her with her pain. She did not find out until her child was 4 and went to an ENT that she was actually tongue-tied after resources stated she was not. So, could a parent request a referral to an ENT?
ENT?
Yeah, ear, nose, and throat specialist.
Oh, okay. Because sometimes, actually, interestingly, I've noticed dentists actually can handle that as well too. And so, again, I think if you're and tongue ties that can inhibit and cause pain during breastfeeding, and also it can also affect the infant with speech, right? And so, I would just again that's what the pediatrician is there for. They should do an infant feeding assessment. They should. Now, do they? I don't know. It just depends. But that's where you really, again, like reaching out to the lactation support professionals. There are IBCLCs within your community, finding those mother support groups, because if breastfeeding isn't going right, and if it's painful, again, there's an issue there, because there shouldn't be pain when you're breastfeeding. So something's going wrong. And so the tongue tie, her finding out until the infant was 4 is unfortunate. But yeah, a tongue tie can cause issues, especially with latching. And so yeah, that's where the pediatrician comes in. But again, if you're unsure, reaching out to those other support groups within the community can also be helpful. And so that you can identify what to do. I know WIC does a great job. And not everybody has WIC, but they have a great job of having those breastfeeding peer counselors on hand, and actually, within the workplace, and where they can do those feeding assessments and talk to you, or having a registered dietitian as well too. Sometimes they can identify those things and then can refer you to the correct individuals to take care of that. And so it's unfortunate, and I'm sorry, but definitely keep pushing on that. So if there's something wrong, a lot of times moms know, and so then find someone that will help.
So that's where we come into play with talking about advocating for yourself and advocating for your child, because that is one thing that most people think, okay, well, the doctor said this, but if you still have that gut feeling, because you know your body and you also know your child. Now I need to just push a little further and ask for a referral to another physician so that I can then figure out what's going on with my child. So that is number one of the best things for us to do. And then thinking about tongue tied, and I know maybe you, Dr. Ship, or Nurse T, or Dr. G can chime in. What is a tongue tied? So what does that mean when a child is tongue tied? I don't know if anyone.
So it's essentially where and they can give a better indication of it, but the tongue is kind of, I don't know, it's like this extra layer of skin
Okay.
that's connecting. The tongue is kind of connected to your bottom, the bottom palate area. And so, and again, the nurses can do a better job explaining, but they end up having to clip it. And that again will help because I've seen infants, like even their speech ends up being delayed because of a tongue tie. And so, but having to clip it off, and then they do a small clip, but I'll let the other medical professionals speak up.
Well, I think you explained it very well. So it is kind of like when the bottom layer of your tongue is, connected. But a lot of times when you bring the babies in, sometimes they will say that they will grow out of it. Because like even with my granddaughter, we was worried about that. But then the doctor was saying that she'll grow out it, and as time progresses, you'll I can tell just a little bit, but her speech is getting clearer, by the day. So
All right. Thank you. Thank you so
as
much.
parents, we worry about everything.
Well, thank you. Thank you, Nurse T and Dr. Ship. Thank you so much. Please continue to hang out with us. Today, I am going to transition to Chris, who will be talking to us about roses. And I am excited to have you, Chris. If you can-
Thank you. Yeah,
Thank
so I work with Dr. Jennifer Johnson's team at Michigan State regarding postpartum depression and the prevention of that. So we found 1 in 8 women and 1 in 3 low-income women experience postpartum depression. So in Rose 1, Rose stands for Reach Out, Stay Strong Essentials. In Rose 1, Dr. Zlotnick and Dr. Johnson developed a training session for 98 agencies serving low-income pregnant women. And they administered the Rose intervention to them. With Rose 2, we wanted to open it up to all pregnant women in the state of Michigan. And now we're in Massachusetts and 10 other states. So we partnered with Henry Ford, where facilitators will administer the Rose prevention classes to women who sign up for our program. And there's 4 sessions that they attend. And our RAs, our research assistants here at Michigan State, will screen them, do a baseline on them, and then send them to Henry Ford's facilitators, where they, provide the intervention and or the prevention. I'm sorry, and then our RAs do a follow up with them 6 months postpartum. And they also do pregnancy check-ins throughout the duration until delivery. So that's what we do. We just opened up to 12 other states, being Ohio, Illinois, Connecticut, Rhode Island, Maine, Minnesota, Oregon, Washington, California, and New York.
So when we're thinking about roses, and I know you're saying it's a prevention for postpartum, what are just a little bit, not giving away everything, but what does that prevention entail? What are they doing?
So the women that enter into the program are they're given a new mom's manual. And in that manual, it's ways to do relaxation, ways to look for signs of starting to feel down or depressed, either during pregnancy or, right after. It gives them ways to talk about their feelings with their significant other or the people that are supporting them, their support system. It also will go over a grief journey part in case, they do get depression, and what they can do if they're having any kind of postpartum grief from, a letdown of delivery, or, not, or even a loss, or what happens, after you deliver, and how do you deal with your body, your feelings, maybe your baby blues, and then what happens if your baby's colicky or something like that. They give you tools and techniques to kind of look at that ahead of time and prevent that from happening, or when you notice it's happening, you understand why it may be happening, and then you can go into your manual or what you've learned in the courses, and you can, practice those preventive, measures and try to get yourself out of that before it becomes too severe or becomes too much, and then you're in full-blown depression or whatever.
Okay. So now does this program also help like just even after having postpartum some? Like, are they still a part of the program or is it just up until they
Yep.
have?
Nope,
Okay.
they do 3 sessions prior. They do 4 sessions prior to delivery, and then at the we let Henry Ford facilitators know when they've delivered through a pregnancy outcome, and they will contact them to do the last session. And so, and then 6 months after delivery, our RAs are following up with them and asking them specific questions, how are you feeling? How are you doing? We administer some measures that, talk about, them specifically and how they're feeling and what they're doing to get support, things like that.
Okay. Okay. So I know we do have all the contact information on the screen for those who want to see if they're eligible for it and to sign up for it. And we also have the link in our chat because I'm excited. I love to hear where we can help all. And I'm excited that this is being opened up, not just for a subset, but for all pregnant individuals who are just so that they can have coping skills. And Chris, thank you so much. This was great to just have. Are there some other nuggets you think people should have just to understand the program before we move to the
I
next?
think we kind of covered it all. You've got to be 18 or older, up to 32 weeks pregnant. They do things over the phone, and they also do video calls and Zoom or webinars to administer the intervention. And the Rose facilitators are wonderful in answering questions and checking in and making sure everybody's doing okay. That's our main goal. We want to do this, preventatively so that more people don't have postpartum and don't have to go on those antidepressants and things like that, and they can enjoy their baby.
Right. So this is a prevention program to help you get through and navigate those things, because sometimes it is just that that thing of self-care or being aware, because you're thinking like, what, it's not, I just need to keep pushing. This is probably just because I'm a mom and I got to get this all done. But there are some things where, nope, take a step back, understand what's going on. So I am very appreciative of a program like this in our area. And thank you, Chris, so much for being here and sharing this, because this is something that we need to get out to everyone to hear that there is something out here for you to do. And it's no cost to you. So this is it. It's no cost to you. So this is also a wonderful thing. And so thank you so much, Chris, but please stay on because I know we're going to have more questions afterwards because people will ask more questions. So thank you.
Thanks for having me.
Thank you. So up next, we will have Susan Lampierre-Sue, who is the project coordinator for HEAL. And I'm going to let you first just take it off, like, what HEAL is and how this can help, our community.
Thanks, Janae. HEAL is short for Healing After Perinatal Loss. It is free counseling over Zoom with master's level counselors for women who have had a perinatal loss, such as a miscarriage, stillbirth, or loss of a newborn in the past year and a half. As I said, it's free counseling over Zoom. Women who are feeling sort of down after that loss can get a free assessment with us and we have a whole list of resources. So even if you're not interested in the study, we'd love you to contact us. We have a QR code on the screen here as one of the easiest ways. Another easy way to contact us with questions is there heal@msu.edu. That is an email that comes right to us with any questions or concerns about the program. We've had about 170 women go through it or are currently going through the program. It involves first an interview regarding eligibility, and then a individual session over Zoom with a master's level counselor, then 12 weeks in a group with other women who've had losses. We find that they really support each other. That's sometimes leads to, friendships that last much longer. And then there is one follow-up individual session over Zoom with that same counselor. There are 3 research interviews where a person can complete if they are willing and receive a $60 gift card as a thank you for that part of the study. If you're a provider, I would certainly be happy to send brochures, pens, anything that you would like if you're in a place where you're often interacting with women who are pregnant or may have experienced perinatal loss. Be happy to send you some materials. And thank you for this opportunity to talk about HEAL and be a part of this panel.
So just before you move away, one thing I wanted to say is how even now, like you have the QR code up, but even just to get it out to, can someone just get it out to their physician office? Like, hey, this is maybe a great resource for the office, even though they had they didn't have a loss, but unfortunately it happens. And so is that something you all would like for someone to give out?
Absolutely, absolutely. If you're a provider, we would love to give you some brochures and pens or a tear-off sheet or talk to your staff. Whatever meets your needs. Probably the easiest way to reach me would be just heal@msu.edu. Like Chris, this is a program with Dr. Jennifer Johnson at MSU, and I would be happy to hear from anybody that has questions or would like brochures or more information.
Okay. Now you talked about the sessions. How many sessions do they have with the therapists?
So there's one individual session over Zoom with that master's level therapist, and we do have therapists that are standing by waiting for more referrals, so we could get somebody in right away. Then there's 12-week intervention. That is a group intervention with other moms, which so a person would need to be interested in a group format, but what we find is they're really wonderful at supporting each other. And then about a month after that 12-week group intervention, there's one more follow-up individual session with the therapist over Zoom. So an individual session, 12 weeks of group sessions, and then one follow-up with the counselor.
Okay. Thank you so much, Sue, for that. And this is something that is needed in the community. And I'm going to probably sound like a broken record for saying this over and over today, but it is unfortunately just so that someone be able to know how to navigate through this, thinking about that great loss and how to navigate life.
Yeah, a lot of our women have had multiple losses. So that can be really, really hard. Almost all of them feel pretty down on themselves, like they've done something wrong themselves, which it'd be really hard to cope with, but yeah.
Thank you. Thank you so much. Please hang out with us. Please, please, please don't leave. I know we have our next guest is, well, before I even do our next guest. So does this program, the HEAL program, we got a question, does the HEAL program offer non-English for non-English speakers?
You can hear me okay, right?
Yes.
I wish it did, but at this point in time, we do not we have a Spanish speaking counselor, but we don't have the ability to put anybody in the study at this point that doesn't have at least a basic understanding of English. That is a future hope. So I wish I could say yes, but at this time I cannot. But
Thank you.
Thanks for the question, Jan.
Thank you. Thank you. All right. So we're going to move on to our next guest, who is Reverend Dr. Q English. She is the director of the Department of Health and Human Services Center for Faith-Based and Neighborhood Partnership. Dr. English today will be talking about M.O.M.S and its Maternal Outcomes Matter Shower, which we will have one here in our area August 24th. So, Dr. English, I first just want to say welcome and thank you for coming. We know you have a busy schedule, so we're glad that you were able to join us. And also just talk to us about, this Maternal Outcomes Matter Shower. What is it? What does it entail? And how does that help with everyone?
Thank you so much. First, I just want to say that I represent the U.S. Department of Health and Human Services, the Center for Faith-Based and Neighborhood Partnerships in Washington, D.C. as a Biden appointee. And I'm just, we have 5 key focus areas. One is the ongoing work around COVID and around vaccinations. And then we have work around youth suicide prevention, mental health, particularly focusing on youth mental health, substance use disorder, inclusive of overdose prevention. And obviously what we're here to talk about today is maternal health. We know that our nation has the highest maternal mortality rate than any developed nation in the world. And so there's really an atrocity. It's really a sad statement. The fact that I even have to say that as the country that we are, as the United States of America, to have to say that, I think it's a real sad state of affairs. In addition to that, our African-American women pregnancy-related deaths are 3 to 4 times higher than their white counterparts, Caucasian women, as well as our American Indian, Alaska Native, 2 times higher. And so when we think of those things, and me working in government and in DC, and then looking at all of these alarming stats, that it doesn't seem to really, it just seems to be increasing in some areas, even though I have to say that our administration has made the most investment when it comes to maternal health and improving maternal health outcomes. And when you think about, I think we have over 200 million through the even the M.O.M.S Act, which was championed by our Congresswoman Alma Adams and our Illinois Representative Lauren Underwood. So, there's a lot of work, great work that's being done. So that what the M.O.M.S Tour is just a small drop in the bucket of working toward improving those outcomes. So when I conceptualized it, I thought, if we're saying that suicide is the leading cause of death for women postpartum, 6 to 12 months, and that's also in line with substance use disorder. And if we're saying that our syphilis now is the newest danger, as our numbers have tripled, then the last thing we're saying is that the support systems that we should have in place with doulas and midwives has been absent from the table, and it needs to be increased. So I said, we need to go through these communities that exhibit high maternal mortality and morbidity rates and actually tie them to resources and services on site. And so the focus of this is like, we don't want to send another email. We're not going to send another posting. We're not going to send another press release. And even if we're going to keep sending those things, we have to show up in the communities. Because me as a Black woman know that our communities show up in places and may not necessarily click on a social media post to hear about the services. But if they can come into a location and get connected to services on site, that makes a world of difference. And so the services, I call them, people call them exhibitors, and I call them my village, the village that many of these people didn't even know existed for them. Case in point, we were in Dallas, Texas, and one woman walked through the doors and she just burst out crying. She's like, and we went up to her and I was like, because I was thinking, oh my gosh, what's going on? And she said that basically, she said, I didn't even know that these services existed for me. And so to be able to connect her, and then her saying to me, hey, I've always wanted a midwifery birth and a birth by a midwife, and to see that she was being able to be connected on site, that to me was powerful. And the way we get them in the door to create these connections is that I have a fiscal administrator that walks alongside of us that throws an amazing baby shower. So now they're going to walk out with resources for their children, but that's how we got to get them in the door. But once they're in the door and they're connected to the village, they're also going to get educated, because at the end of the day, it's not the resources that are saving lives, right? It is actually the education. So we do a major push on education, empowerment, and engagement. And so I have a doula and a midwife that speaks to them on what a support system look like. I have an OBGYN, and they talk about, what do I need to do to advocate for myself in these healthcare settings? Because at the end of the day, while we talk about a broken healthcare system, the system is what it is today. So while that system is still in desperate need of repair, we teach these women how to go into these places and advocate for themselves. And I think that's a very crucial, critical element, because a lot of them don't even know what preeclampsia is. I'm having headaches, I'm feeling this, I'm feeling that. And their doctors are sending them home with the Tylenol. And so for me, the education is power. Being able to say, hey, I got pain in my belly, I'm experiencing this. So we teach them, here are the different signs to look for that creates a critical need for you to talk to your doctor about that. And so those have been quite empowering. And then we have those with lived experiences that share as well. So it's that peer-to-peer piece of, this is what I've done, this is what I should have done differently. Now here's my support system, and I encourage you to do the same. And then lastly, on that panel, we have someone from a mental health specialist that can talk to them about, here are the signs. I don't feel like holding my baby. I'm feeling anxiety. I feel like these are we break it down to real granular level, even defining postpartum, right? A lot of us take for granted these vocabulary words that we're used to being around. And so, at the end of the day, we find that we have an increase of those that have this interest in mental health services. So last year, as a case in point, when our pilot, we had a short pilot. This year, we're touching 25, we're going to go to 25 cities. It's aggressive. And they looked at me, they said, you want to do how many cities? I said, I want to do 25 cities. They said, they said, Dr. English, that's quite aggressive. I said, yeah, because we're aggressively dying, period. So it's aggressive, yes. It's intentional, yes. It's necessary, yes. So last year when we launched our pilot, we launched with and plus, my background is advocacy team. So advocacy for me is number one. I'm in now serving. Yes, I'm the director, top of the food chain in my center. But at the end of the day, I love that I'm able to marry my grassroots experience with what I'm doing now. And so I used to get arrested every Martin Luther King Day. So that's me, okay? And so last year when we created this, we had over 5,000 women that we connected, 1,700 that ended up with mental health care services, connected to mental health care service, over 800 connected to doula midwifery service, over 500 able to be connected to just healthcare service, which lack of it contributes to these morbidity issues that we've seen. And then over 200 in line with the incredible champion, our vice president, who championed the maternal health blueprint, said we need to expand our perinatal task force workforce with culturally competent individuals. So part of my movement is doing just that. So last year we were able to see certified over almost 200 African-American doulas. And then few of those were men. So now, they're doulos. And so I'm just excited about this movement. I'm excited about what we've done so far. And I'm excited about coming to Flint to connect more women to their services. So I'm going to stop there because I can keep going on in this space, and you can hear my excitement, you can hear my passion, and yes to all of the above. But at the end of the day, seeing lives change is what matters the most. And, we're going to continue to do this until the U.S. becomes one of the safest places for women to give birth. Thank you, Johnny. Back to you.
Thank you so much, Dr. English. And I love your passion, and I'm grateful for your passion. I'll say that as maternal health is one of my passions, and health equity. And like you said, we are in the United States of America, one of the richest countries in the world, with the worst maternal health outcome. And to hear some of the things that some young ladies say, I don't want to have children. I don't want to because of the lack of, I don't know if I'm going to make it out or my child's going to make it out. But then we got people like you, like all the people that's here today, to tell them we're here behind you. And now they get the doulas, they can have a midwife. And those are things for me. My grandmother was a midwife, but she was a midwife right before they outlawed midwives. So if anyone understand that, she learned midwifery in the 1940s, and she was doing that, and then they outlawed it. But this is how people and some of our African American mothers live, because they had someone who understood what they were going through and was in the community walking them through it. And now we have this wonderful our VP who is championing maternal health, who is pushing for the maternal health. And I'm excited, and I'm trying to slow down, but that's something we need. And then we have our community baby shower, which I'm excited for, on August 24th.
Yes.
That is coming up. So that is a wonderful, wonderful, wonderful baby shower.
Yes. And thank you, Heatherland, for everything, for being a part of the executive planning committee, just creating this space of collaboration, because it is going to take a village. For me, and Johnny, as you were talking, I was just thinking about the fact that we, it takes a village. It takes government. It takes faith community. We would love to see faith community identify some congregation members that would like to be certified as doulas. I have someone walking alongside of us that is offering free certification for doula services. And we need everyone. For me, it's about, how do I move in these spaces and create sustainable models so that it doesn't matter when government changes hands, because that's the thing, government changes hands, it seems like things fall apart. But we don't have to fall apart, because there was a day when the village raised its children, and we can see that restored once again. And that village comprises all of us, and that education model is so important, and that the faith community showing up intentionally in these spaces has been important. In Philadelphia, the One House of Worship certified 40. So they're not just supporting their own pregnant and postpartum women, but they're supporting the community as well. I just wanted to put that out there, because I forgot to mention that, Johnny, about the free certification.
Okay. Yep. No, thank you so much. Because that is something we need to get out and let people know about, this free certification. And like, we know that you can have some exhibitors and volunteers that can attend this shower. All people who work with pregnant and postpartum people try to attend this shower, but also those who want to know more and want to see what's out there because they want to help, or those who just, I'm pregnant. I need some help. I need to know what's out there for me, what help is out in the community for me, or you want to be a doula. And they have someone who's going to do it for free. I would take great advantage of being a doula because now that's free, a free certification that you can help bring more people to this. So please, please, please look at that. Look at that. I'm not gonna keep, but I would love for you all to do that. And then let's talk panelists. If you all would like to be a part of this exhibit, I think this will be great for each one who's all talk. That you may have a table there, or we can share a table. It doesn't matter. We can all be together, but those are informations that should be out there that our community would know. Um, and Nurse T and Dr. G, I don't know if you all will be there, but I hope so, because I know Nurse T is always a part of those things that's moving forward for the health of those in this community. This is where we need it. Please, you can all can chime in on some of the things that you think is great, and Dr. English, you as well, on how this is going to impact the community.
I was going to say thank you for your presentation and your passion. The one thing that I realized from being in the community and developing a passion for health equity, as well as developing a passion for grassroots, is that it's something when you're in the community and you set up a table or you mobilize services to their areas and they just happen to walk by. And then in that instant, you create a safe space to have a conversation with them and engage them in a conversation. And then it's amazing to see the walls and the barriers fall, and then they feel free. So the one thing I always encourage, and the one thing that has given me great pleasure, is to be able to create those safe spaces for the community to be able to engage, receive health literacy education, as well as when you was mentioning about the systems. Even being an advocate, I know the one thing that I can't do is change the isms. But the one thing that I do try to do is help patients navigate through the systems so that they can have better healthcare outcomes. And I think sometimes that's an advantage, but at sometimes that can be a disadvantage too, because thinking from a healthcare provider as a nurse, I don't feel like I should have to do that, because they should just be able to go to a system and be fairly treated. But I know that over that us doing above and beyond and doing what we are called and anointed and appointed to do in this season will help transition our community. So thank you so much. And I appreciate, and whenever you do come to Flint, Michigan, let us know whatever I can do to help. I'm on board.
Yes.
That's
Yes, thank you.
fantastic. Go ahead, Latrice.
Oh, yeah. Hi. Thank you for your wonderful presentation, and thank you for all your input. Changing the social determinants of health as the driver. So we know when we say determinants, those are things that some people think that they can't change. But the program, that's the same thing that we do. We love to be out in the community, the grassroots, helping people take their power back by learning about the signs and symptoms. And we'll love to be out there to help, even with teaching, doing blood pressures, to help with, preeclampsia or things of that nature. So we thank you for your wonderful presentation and information, and we look forward to seeing you out in our community providing resources. Thank you so much.
Thank you, Latrice. Yes, and we advocate for pop-up clinics, syphilis testing,
Yes.
screenings, vaccinations, etc. So yes, that's part of the village. Thank you.
All right, thank you.
Use you for that.
Thank you.
Thank you. Thank you. But anyone else who would like to chime in on this and think about this here? This is really, everyone who spoke today really spoke volumes on how we can help the maternal health equity here in Genesee County, but not just Genesee County. If you look at it, all of these was across Michigan. So how can we move this needle, get it out there, and let people know that we're not just in this building, or as you see behind me, you see Michigan State University's, the College of Human Medicine building behind me here in Flint. But we're not in that building, just in that building. We're actually moving out into the community because we know, yes, we have ideas, but we need to get to the community to see what is it that you need and how is it that we can partner together to move forward. And like Dr. English say, it's a village. It takes a village to raise a child, but I feel it takes the village to move forward, for all of us to move forward, for all of us to thrive and not just survive. The problem is we're just surviving and we need to thrive. And how do we do that? And that's with us together. And that's with us taking it together. And that's with us advocating together. And that's with us pushing together to push forward so that everyone, every woman that walks through the doors to have her child has it in an equitable way, has it with dignity and pride, and not being afraid or ashamed or put to shame by someone else. So how do we do that? And that's by us working together, coming together. And I hope to see you at the baby shower on August 24th. I will be there. So I'm hoping that more people will come out, because we are going to champion. We are going to push. We're going to show what you can do. We can talk to you to show you how you can advocate for yourself. And if that doctor doesn't listen, there's another one. Trust me, there's another one. So keep moving, and we're here for you, and we're here to help you. And I want to thank you for joining us. Any last words? I'm sorry, I forgot about my own. So I am a part of what is a multi-level intervention for advancing maternal health equity. And we have what we call an anti-bias training, which you can get CME credits, and it's online, it's free. And our next one is September 20th, and it's from 9 a.m. to 5 p.m. You can actually go to the workshop to register for the workshop. This is a great workshop. It is actually done online. So we are live online talking with you, but it's interactive. And we ask you questions and we get you thought provoking, because those are things that we need to start thinking about. How can we make it better? How can we do things better? So I hope just greatly that you can join it. And it's for not just for physicians or nurses, it's for the social workers, it's for the front desk, it's for the back office, people who work with people who are postpartum or prenatal, all birthing people, those who work with birthing people. This is what this is for. And it's to help bridge that gap, close the gap of disparities for maternal health and make it a more equitable place for us. Are there anything else? All right, we have the deadline for the 2024 research. Daddy. That was extended. The abstracts are due August 19th. So I hope that you can join HFRCC, which is September 27th. But if you have an abstract and you want to submit one, please submit it. The deadline has been extended to August 19th. The QR code is here, so you can submit your abstract. Trust me, I know about trying to hurry up and get that abstract in, but get it in. This is a great place to just show what you're doing in the community, what research you're doing in the community. So that is one that we have, and I don't think we have anything else that we need to show. Oh, continuing education units for community health workers. This is one. You can get CEUs for the webinar. If you attended the webinar, you can submit for your certification. If you have questions, the email address is at the bottom. And this is a great way that you can continue your education and bring yourself on board and staying on top of, if you're in the maternal health space or what space you're in, that you can stay on top of what's going on in the community and get connected.